Hello, and welcome once again to the Dental Marketing Mastery Series. This podcast is brought to you by dentalwebcontent.com and New Patients Incorporated. I'm Howie Horrocks, the founder of New Patients Incorporated. Along with me once again is my friend and partner and the president of New Patients Incorporated, Mark Dilatush. Well, hello, everybody. Welcome once again to our podcast. And I'm in Vegas, and Mark is out there in New Jersey land. How you doing, Mark?
Hello, Howie. I'm doing fine, thank you.
Wonderful. What are we talking about today? I think it's we're going to continue our series we started there last week.
Well, we were going to try to get through the top 10 in one podcast.
No way.
That was silly planning on our part. So we only got through 3.
All right. This is the top 10 ways that you can wreck your marketing results.
Yeah, if you really are committed to totally and completely destroying your advertising results, just follow this handy guide and
and you'll succeed.
And you'll succeed. Yes, absolutely. So number 1, 2, and 3, just a real quick recap. Number 1 was not giving advertising enough time. And that's true of all advertising.
Yeah.
Number 2 is a lack of result transparency. In other words, you don't really know, most of you don't have any way of knowing really what the true results are. So you end up running around looking for that panacea. And it's really actually, you probably tripped over it once and thought it wasn't working. Number 3, having unrealistic expectations, right? And that kind of reverts back to number 1. So that's what we went through last time. This time, we are going to discuss treating the practice like a business, and specifically budgets and applying them and deploying them and so on and so forth. Having multiple people responsible for your whole campaign, that's number 5. Number 6 is promoting to the wrong half, potentially for too long. So we're going to go through, let's start with 4. That's a good place to start, right? If we're coming off of 3.
Actually, the thing, the title is not treating your practice like a business, right? That's right. A mistake.
Right. That's right. So, and we hear this all the time, and I'm sure it comes from solid roots. The doctor is the giver, right? The nurturer, the provider of health, and it's all about, providing care. In most dentists' minds, that's what it's always been about. It's why they get up in the morning. It's why they do what they do. And so, for some, it's very difficult to operate the business and think like a business person, right? Let's just call it what it is. It's just difficult. And we get it. We understand, we understand the push-pull with the emotional side. But as it pertains to completely destroying your advertising results, one of the easiest and fastest ways a dentist can destroy their advertising result is to not have a budget. That's the first step. Just multiply your revenues times about 5%, and that should be your budget. You can divide it by 12, so you have a nice monthly nut to cover every 30 days, and there's your month. That's what you should be spending on advertising to grow your practice. And almost every market, you should be able to grow a practice. I'm not going to say any practice, but I'm going to say you should be able to grow a practice in almost any environment in the U.S. for about 5%. If you're over $1.5 million in revenues, you can chop that down to about 4.5, maybe even 4, and start there. So the first step to avoiding having it hurt your advertising is to have a budget. A budget is a spending limitation. It's not a promissory note. You're not promising that you're going to spend. You're just saying, I'm not going to spend over this amount.
Right. You can spend less.
Yeah.
You just can't go over.
Right. So the first step to fixing that is to have a budget. The second step is to have it be consistent. Now, here's some good news. Dentists like consistent monthly payments. Howie and I, as business owners, hell, if we could and we'd try, we'd probably split up all of our expenses in even monthly amounts.
Yeah, that'd be easy.
It makes everything that much more visible. As you go day to day, week to week, month to month, where your profitability lies.
Right. It's predictable. That's a big comfort and a big thing you can lean on. You have things be predictable.
Right. So if you're not advertising, you're not spending any money on advertising right now, and you want to, put your toe in the pool, so to speak, then, carve out a reasonable budget and divide it by 12, and that's going to be your new monthly budget. And you're going to maintain consistency, just like every other business in America does when they advertise for, in their case, customer acquisition, in your case, patient acquisition. Every business does that. They may pick and choose their spots. There are reasons, locales, seasonalities, and specialists, dentists, that would have a reason not to have a good, solid, consistent 12-month, exactly the same monthly budget. But for 95 or 98% of the GPs listening to this, yours should be the same every month and get locked in. Now, here's what you saw. Here's the problem this solves. This solves the problem of the dentist who is very slow. Oh, things are slowing down. I will ramp up my marketing. Then they overspend. Then the phone rings. Then they begin to fill up. Then the dentist pulls back on the advertising budget. Then it gets slow. Then they overspend. Then the phone rings. Then it gets a little busier. They feel better and they pull back their marketing budget. Well, every time they do that, they're losing money. Every time they push hard and then pull back, push hard, and then they're losing money. They're losing money needlessly. All they really had to do was establish a nice, consistent plan, a nice, consistent advertising spend, and the results would come in a smoother fashion. They could plan their capacities in an accurate way. They can manage their patient care in an accurate manner. They can expand in an accurate manner. They can do all those things accurately if it's consistent. If it's inconsistent, you can't. You're pretty much reacting rather than being proactive with your budget. So that's really the first one is treating your practice as it pertains to advertising.
Yeah, dentists have often, like you alluded to at the beginning, that they have an ideal what the practice is. It's like you said, you're the caregiver, you're the doctor, and that's what you conceive your practice to be. And go ahead, that's wonderful. But at the same time, you have to realize it's also a small business and is subject to the laws of supply and demand and customer acquisition and everything else, economics 101. So, if you're a solo GP and you're not seeing 18 to 22, 19 to 23 good, solid new patients a month, you're probably plateaued. And if you look at your numbers and you see 15 a month for the last 12 months, you are plateaued or you're going backwards. And if you're not yet, you will. It's just it'll happen. So, you have to maintain that level in order to continue to grow as effectively and efficiently within your limitations. Your limitations of your practice are your operational hours, the number of treatment rooms, and the number of dentist hours in the practice. Those are the only three limitations you have. So until you maximize those and then start to begin to grow out of your walls or
or you're growing at the seams, so to speak, then you need to continue to advertise at the current level that gets you there. And then you have a decision to make, which is a really fun decision to make. What do I do now with all these patients, right?
Yeah. All right. Let's take a short break here. We're going to come back and talk about the other two items on our list. So don't go away. We'll be right back. Hey, Mark, we should tell people about this new product we have, NPI Command.
Well, probably new to the podcast listeners, but not new to the customers who use it. So let me go through the finer points. NPI Command is a system we use. It's an artificial intelligence system that creates decisions on where dentists, our clients, should put their pay-per-click money when they do Google pay-per-click ad campaigns. If you're someone who's already done them, then you're probably frustrated by the cost of the negative clicks. Well, if there's an artificial intelligence platform monitoring your negative clicks, you can see immediately how doing these on an artificial intelligence platform will allow for a faster build and the faster allocation of the advertising money to the places that are bringing in good clicks. Because with every PPC campaign, there's sources of bad clicks and sources of good clicks. And the whole idea is to throw all your money in the good ones and pull your money from the bad ones. So NPI Command is our PPC department. And it's not just a department of humans, it's an artificial intelligence platform as well.
All right, we are back. And what's our next topic here, Mark? It's
topic number 5 of the top 10 ways to completely destroy your advertising results is to have 2, 3, 5, 7, 9, 10 people handling certain aspects of your overall marketing.
Yeah, people or companies.
Yeah, people or companies or sure. Yeah. It's kind of amazing to watch and it's very common we'll get on the phone with the dentist and the dentist will say, I've been doing this, I've been doing that, and I don't know, it just doesn't seem to be working like it used to, or I need it to work better, or, kind of a easy to understand conversation. And we said, okay, well, let's look at your assets. One of the first things we do when a dentist engages us is we try to look for we try to determine what money they've already spent on advertising. And then secondly, we determine which of these things are current assets. And classic example is a doctor who built a website. Doctor paid a company, built a website. That if it's not, if it's not the tooth guy brushing the back of his head with a bloody sickle in his hand, if it was put together, reasonably well, we would consider it anywhere from, a 50 to 100% asset when we're trying to figure out what this dentist should prioritize for their marketing budget. Well, okay, so there's a website developer, and within that website developer, there's probably 2 people, a graphic designer and a coder. And if there's not, there's someone that knows some kind of programming. And then sometimes those people will go and hire an outside, what are called SEO firm, like search engine optimization firm. So now we have a website, maybe a graphic designer and a programmer, and an outside SEO person. And that SEO person sometimes turns into a Google AdWords person, but that's a different department, right? So they're referred over to a Google AdWords department. So we got 2 people working on the website. We have 1 person doing our SEO and this other organization doing our AdWords. And the doctor comes in after going to a Saturday conference somewhere in Minnesota and says, I need somebody on my social media. So they hire a 5th company to handle their social media aspects of the promotion of their practice. And pretty soon, when you talk to a dentist and you say, hey, who's handling your marketing now? They say things like, well, Larry, Jen, Barbara, Bill, Stephanie, Rick, and Jerry. Okay. They're handling my marketing. Okay. And Howie and I we're sitting there scratching our heads going, How is that even possible? I mean,
doesn't that get confusing?
Yeah. I mean, we have all those people on staff and they're all employed by us. And sometimes it's difficult for us to get our own people to understand, the orchestration, the blending, because when you promote anything, when you market anything, I don't care if it's dentistry or sneakers, right? There has to be there's a timing to everything. There's a structure to everything. There's a design that needs to be, like, for instance, let's just use a classic example. We have a dentist who, I don't know, let's say it's a startup. We have a dentist and they're brand new, going to open up a practice and they need a website, they need SEO, they need an AdWords campaign. Let's do a trifold and a postcard, two different halves of the market. Let's do this piece, that piece, the other piece, right? Well, that could be 11 people.
Yeah.
From 5 different companies who know nothing of each other. They don't know what the overall strategy is. They just know what their strategy is. They don't know how it dovetails in. And wait, now you add online scheduling, review rep management. I mean,
guess who has to manage all that?
Exactly.
Doctor?
Right. Exactly. So
that's tough.
Right. So here's number 5 actually should be retitled to, this is one of the top 10 ways to destroy your advertising results and drive yourself crazy.
Yeah.
Okay. Because these people are going to come to you with the questions.
Yeah.
Right. And you're going to be in between patients and you're going to have stress and you're not going to know exactly what the left hand and the right hand's doing. And pretty soon you're going to get tired of this stuff. So number 5 is having multiple people responsible for your overall marketing. Number 6.
Yep. Okay. Yeah. I was just going to add, no matter what kind of marketing you're doing, different types of marketing, they all have to work together, especially thematically. You know what I mean? It's
tell everybody what you mean by thematic.
Thematically, it's like, well, you have your website colors, for example, chosen by maybe you or the designer, and then the marketing you put out doesn't look anything like your website. Doesn't even look like the same person owns the two.
Right.
So this can confuse your audience. So that's why
especially when they go from offline to online, they don't really see anything that either smells or tastes the same.
Yeah, exactly. Right. And it can hurt your marketing results. Okay. Yeah. Let's go on to our next one.
Okay, promoting to the wrong half for too long. So, Number 6. These days, this should probably be number 1, but we're going to put it at number 6. Promoting, for everyone who doesn't understand what promoting to the wrong half means, basically, there's 2 halves of the dental market. They're the moms, half of the market. Well, let's all agree that moms are the dental market. 90% of the calls that come into your offices are women. So let's assume that. And let's say that about half of them will absolutely choose a healthcare provider for their family based primarily on a price incentive, and you see them all the time. About another half, it's actually about 48%. The other half of the market absolutely will not choose a healthcare provider for their family based primarily on a price incentive, and they would honestly look at you like you had 3 eyes in your head if you asked them to. This is not a judgment call. This is 52-48. That's all it is. Okay. So, normally when someone is needing a quick, high capacity of new patient flow, you can use deals to get the phone to ring, and you can use a thing called insurance participation to get the phone to ring. And you can usually use both of those for a relatively short period of time in order for the practice to gain a financial footing, right? In order to make sure that, payroll's covered, we've got our first dollar framed and on the wall, and we're not going to fail, right? But all too many times, that's where the practice stays, and they never really move from price incentive promotion and insurance participation over to attracting the higher quality half of the market who's really just looking for a great dental practice for the family, not necessarily the cheapest dentist in town.
Right. And they tend to stick with practices that they're a hot more. I hate to use the word high quality, but it's true. They're a better patient. They stick around longer. They're more compliant to recall because they want a value for themselves and their family.
Right.
And that's the top half of the market.
Right. Yeah, they're the moms who call and make an appointment and don't ask you how much is it or do you take my insurance, basically. Right. Okay?
Right.
They're calling for a different reason. Or maybe that's the only question they knew to ask, and then they come in and they seem like a different person. But every dentist listening to this, I'm sure, understands what we mean when we say the difference between a shopper and a good quality new patient. I'm sure everyone understands that. So, okay. So what do we mean when we say promoting to the wrong half for too long? What happens is dentists get caught up in that volume game. And pretty soon, let's just take this from a local market aspect. Doctor's been promoting to the bottom half of the market, deal, takes 9 different insurance plans, is on 9 different insurance plan lists. Phone calls come in. Boy, you should be able to fill a schedule relatively quickly, and you should be able to get at least somewhat profitable within at least a reasonable amount of time. The problem is that the insurance companies are taking anywhere from 19 to 26, 27% of your fees, and they're keeping them for themselves for the privilege of putting you on a directory that's online. Another part of the problem is that you're spending advertising dollars to generate patients who, not all of them, but come on, let's face it, you're going to kiss a lot of frogs to find your prince. These patients will absolutely look for the next deal the next time they need a dentist. They are far less compliant to recare. In other words, the return on investment with that half of the patient pool is about 11 times less than the top half of the market. So if you do that continually and you don't start to shift to the top half, your marketing resources to the top half, what happens is you end up a practice that's, I'm getting 30, 40, 50 new patients a month as a solo GP, and I need more.
Right. They become more patient junkies.
Yeah, they become new patient junkies. I mean, in our meetings here, we have, that's what we refer to them as. They're new patient junkies. They just can't get enough. The problem is that if you keep focusing your advertising on the bottom half of the market for long enough, you will always statistically get less of a result for the same cost. And that's when they call us.
Right. There's another problem too. If you continue to promote to the bottom half, is you put yourself in direct competition with every corporate office in the area. And they have a much larger marketing budget than you will ever have. And you will be engaged in a price war with them, and you will lose.
This is also true.
Sorry.
Right.
You will lose.
Right. But temporarily, if done properly, you can use price promotions, you can use insurance participation temporarily to build your base.
Yes.
Get yourself busy. Get any number of revenues coming in just to keep the bank loan person off your back, right? Then slowly but surely begin to allocate your advertising budget more toward the top half, with the things that the top half responds to, which are very different than what the bottom half responds to Groupon. The top half would never respond to Groupon. Okay, so they really respond, the two halves respond, I'm not going to say totally differently, but I'm going to say very differently from advertising media and messages than the other group. So,
Yep.
That's number 4, 5, and 6. Treating the practice like a business, having multiple people responsible for your whole marketing plan, and promoting to the wrong half for too long of a period of time.
And that'll about do it for us today. Thanks for tuning in. We appreciate you out there in the audience, and we will talk with you next week. Bye now. We hope you've enjoyed our podcast today. You can find more podcasts on our YouTube channel, on Stitcher, and iTunes. Also on our websites, dentalwebcontent.com and newpatientsinc.com.